Good morning, everybody. So in the next presentation, I am going to talk about some aspects of gender dynamics related to and the effects on contraceptive use in Angola. And I would like to acknowledge my co-author, Suzanne Bell. She's here somewhere. But as a background, we found that even when wives have incorrect perception of their husband's approval of family planning, that can per se be their perception can be predictive of uptake of family planning. It is also known that fertility intentions of the husband could also predict subsequent fertility. So what we wanted to do by looking at two aspects of gender dynamics, husband's approval and husband's encouragement to family planning, is look at the data available for Angola, which is a country that still has high fertility and relatively low contraceptive use. And very little is known about very little is understood about this interplay in terms of gender dynamics or social norms. And remember that Angola was a country ravaged by 30 years of civil war. So it was only the detailed data about some of these aspects of fertility were not available until recently because large-scale surveys such as demographic and health surveys were not conducted. So what we hypothesize is that the female's perceived husband's or partner's approval of family planning will directly have an effect of modern contraceptive use. But we also realize there are two important moderators or potential moderators of this relationship, the self-efficacy for contraceptives and perceived access to contraceptives that we will have to take into consideration. But we also believe that even after controlling for that, this aspect of gender dynamics, such as perceived gender approval, male approval, would still hold as an important factor affecting modern contraceptive use. So similar to women's perceptions of male approval of contraceptives and this relationship, we hypothesize that perceived females' encouragement of male contraceptive males' encouragement of contraceptive use will also have a similar effect on modern contraceptive use. So what we did in terms of data is that we used a 2012 survey, population-based survey of women of reproductive age conducted in Luanda province. Luanda province is where the capital city of Angola is and houses about half of the population, 1/3 of the population of Angola. And we use, sorry, I'm going too fast. We use in the analysis the self-efficacy scale for using principal components analysis of various Likert scale questions, Likert scale from 1 to 5, or whether or not a woman felt comfortable using various methods of contraceptives, for example. So we use logistic regression and two models. We analyze perceived encouragement and perceived approval separately, and we use the first model to look at the gender dynamics aspects, controlling for socioeconomic variables, and the second model we control for self-efficacy and perceived accessibility. So what we find is, with respect to perceived male approval of family planning, women in Angola are 3 times more likely to use modern methods if they perceive that their partner approves of family planning. However, when we control for self-efficacy and perceived access to family planning, we see that relationship decreases. So it's 2.2, the odds ratio, but it still continues to be significant. But at the same time, the self-efficacy and perceived access are extremely important in the relationship to contraceptive use. So when we look at the results of the variable male partner encouragement for family planning and contraceptive use, we see that 40% of women that perceive that, they're 40% more likely to use contraception. However, when we control for self-efficacy and perceived access, that relationship completely disappears. So self-efficacy and perceived access becomes more important. So in conclusion, of the two gender dynamics aspects that we analyzed in this particular population, perceived male attitudes towards contraception that was predictive in this context was perceived approval of contraceptive use, not perceived encouragement. However, it is difficult at this point for us to know what the difference these women think when they say yes, they perceived approval versus yes, perceived encouragement, or no perceived encouragement. And we think that only more in-depth qualitative analysis basically can help us make that distinction. But what is important to have into consideration is that self-efficacy and perceived access to modern contraceptions are very important factors in the uptake of modern contraceptive use in this population, and these two aspects have significant impact in the programmatic and the policy decisions that are being taken in Angola right now in family planning. Thank you very much.